The infant feeding tube of various sizes count. This is usually ranging from 5, 6, 7, 8, 9 varaikkum. I think this is size 7 or size 8. No problem. Yeah. How to sterilize these tubes? So all these plastics, how are they sterilized? Hot water. Hot water போட்டா வரல வேணா ஸ்டெர்லைஸ் பண்ணிக்கலாம். என்ன படிக்கிறப்ப ஸ்டெரைல்னு போட்டு ஈ போட்டு ஓ போட்டிருக்குல்ல அப்படின்னா என்ன அர்த்தம்? எத்திலீன் ஆக்சைடு ஸ்டெரிலைசேஷன். என்ன இடிஓ ஸ்டெரிலைசேஷன் பேர். எத்திலீனுக்கு இடி, ஆக்சைடுக்கு ஓ, ethylene oxide sterilization. So similarly, even if you see this, will ETO sterilized. So all this rubber tubing will melt by heat or boiling or autoclaving. So அதை பண்ண மாட்டாங்க.
So folies வந்து எக்ஸ்ட்ரா யூனிட்ஸாக போடுறது.
ஆமாம், எக்ஸ்ட்ரா யூனிட்ஸில் இன்னும் போட்டுக்கலாம். So this one is rice tube. Rice tube. Length of the rice tube is 105. 109 எங்க இருக்கு? ஒரு ரூம் பேர் நம்பர் 109. 105. என்ன 1 meter and 5 centimeters. Okay, it will have 3 side holes. It will have 3 lead balls. If you take the X-ray, there will be 3 lead balls inside. Right? And it will have 3 markings. All 3. 3 side holes, 3 lead balls, and 3 markings. First marking is at Bodhi junction. It is 40. Then second marking is at 15 centimeters beyond that. That is 55. This one is 70. So when you push the tube up to this, then we know if you push from here, we will know it has reached the joint. So almost pylorus. So these markings are important to find out how far this rice tube has gone inside. The uses of the rice tube are
aspiration,
nasogastric suction, as well as in unconscious patients feeding. So other tubes which are used for feeding are intestinal feeding tubes, which are a little longer, which are called as Baker's tubes. Baker.
The purpose of the lead balls is to know the level of...
To know where it's at.
In X-ray.
Yes. Where is the position, whether you have placed it correctly or not. So usually after inserting, what people do is to inject little air and find out, keep this depth and find out whether it is inside the stomach.
lab coding instruments
ஓபன் பண்ணிடுறேன்றியா? யார் ரொம்ப ஸ்பெஷல் வார்ட் பேஷண்ட்டா? சரி, கன்சல்ட் பண்ண அடுத்த நாள் தூக்கி போயிடுச்சு. இங்கே வந்து ஒரு கேஸ் தான் போல இருக்கு. ஒரு லேப் காலி தான் என்னமோ போட்டிருக்கேன்.
2 இன்ஸ்ட்ருமெண்ட்ஸ் ஒன்று ஆக்சிஜன் யூனிட்ல இது பண்ணி பார்க்கணும் சார். ஓகே, அங்கே வந்து பண்ணிடலாம் சார். யூனிட்ல வந்து
கோழிங்க முடியல, முடிஞ்சு போச்சு போல இருக்கேன். கல் பொறுக்கிட்டு இருந்தாங்களே,
இன்னும் இது எடுக்கல சார்.
ஃபோட்டோ எடுங்க. அப்போ வந்து ஏன் சொல்லி
வாஷ் பண்ணிட்டு
லேட் ஆகிடும் அப்படின்னாலும் அடுத்த நாள் மாற்றிக்கும்.
சரி, நம்ம மேடம் கேட்குறேன் சார்.
கேட்டுக்க. So the intestinal tube is called as Baker's tube, which is little longer. That is also used for feeding purposes. Right? So how will you place an intestinal tube? Just endoscopic guide. Endoscope போட்டு கைட் பண்ணி கொண்டு போட்டு வந்து சரியா? என்னம்மா? Length of the intestinal tube. It can be more than this. Can up to 2 meter length varaikkum. So usually in pancreatitis what happens, the nasal feeding has to be started early. So you want to start the more delay if you make in feeding the patient, they undergo more sepsis because of stasis of the entry contents. So whenever gut is available, we have to use it. Then ICD bag, ICD tube. This is called as the ICD tube, intercostal drainage tube. This is also sterilized using ATO, right? So you can put it inside the thoracic cavity in various conditions. What are the conditions? Trauma. In trauma, if there is going to be pneumothorax, hemothorax, so after that hydrothorax, there is pyothorax. These are the conditions. Plus, whenever you open the thorax, thoracic drainage post-operatively, also this is used. Right? This is cuffed endotracheal tube. What is endotracheal tube? Cuffed endotracheal tube. Right? So this has got a cuff and a lumen. So there are double lumen tubes. One lumen inner lumen comes where you can inject a little bit of air inside, inflating this cuff at the tip so that the endotracheal tube doesn't slip out of the larynx. So it is passed beyond the vocal cords. When you inflate, the vocal cord holds it. Forcibly pull, what happens? You will have only the torn vocal cord. Right? Then the urine bag here. This is the bag for connecting into ICD tube. The urine bag. There are, apart from this double lumen Foley's tubes, there are triple lumen Foley's tubes also are available. Triple lumen is mainly used for giving bladder irrigation and washout post-operatively following TURP. TURP is transsection of the prostate, right?
So what are the uses of Foley's?
So whenever there is retention of urine, whenever there is a patient, you want to measure the intake output in an unconscious patient. So you want to have the exact amount of urine that is being secreted per hour. What is the amount of urine secretion per hour? 30 to 60 ml per hour. 30 to 60. 1 ml per second. Right? So 30 to 60 ml per hour is the normal urine flow. If it is not there, you will know the patient is not getting any urine. You want to find out in a hypotensive. If the patient is hypotensive, you want to find out whether the patient has gone in for anuria or not. Anuria. Anuria means there is no urine secretion. Then also you have to put inside the Foley's and measure the output. So, STLC4. நானும் வரேன் பின்னாடியே. சரி சரியா? வேற என்ன இருக்கு? Apart from this, there are some catheters which are called as Malicard catheters, which will have a flower-like tip. Sometimes we used to have a Gibbons catheter also. I don't know whether people have it or not. Gibbons catheter will be looking like a Riles tube, but only thing it will have a ribbon. So Gibbon has a ribbon.
So without incision, can Malicard get it?
Malicard incision இருந்தா தான் போடும். இன்சிஷன் பண்ணிட்டு அப்படியே புஷ் பண்ணினா உள்ள இருக்கும். Without incision டீ தானே இது? பாயசம் மாதிரி இருக்கு. டீ தானே பாயசம் மாதிரி இருக்கு.
what's
Nephrostomy.
Nephrostomy. If you want to use a nephrostomy, what you use is called something called a nephrostomy tubes are available. So it will look like a polish, but it will be little whitish in color. It will have a small bulb which can be inflated. Like Fogarty's. Have you seen vascular catheters, which are called as Fogarty catheters? Thin catheters which can be put inside the opening. Then you inflate little air. It will begin. So mainly they use nephrostomy for cases whom they do something called as PCNL. What is PCNL? Percutaneous nephrolithotomy. After that they use it. Right? Yes. When I let you be parted. Pigtail catheter. Pigtail catheter, what are the uses? Abscess cavities, like a particular abscess you want to drain, ultrasound guided, you can put it inside and take it out. Or splenic abscess. Liver abscess also can use. Any abscess cavity, it will be like once you put the insert, it will straighten out. Once you take it out, it will roll like a pigtail. Pigtail பார்த்திருக்கியா அப்படி சுத்திட்டு இருக்கும். ரொம்ப ஆட்டி இப்படி போறப்ப தான் தெரியும். It's called as pigtail catheter, pigtail drainage. What are the other drainage tubes available?
Plastic drainage.
What is Penrose drain? What is corrugated drain? So what is normal suction drain which we are using? Put bellosla vachi எழுதுறோம். Yes. What is the classification for cancer penis? Staging? Jackson. So this is again called as Jackson-Pratt's drain. Jackson-Pratt's drain. This is Jackson's classification. Jackson-Pratt, P-R-A-T-T. Rome-Vac, Redi-Vac, all proprietary names. The original name of the drain is Jackson-Pratt. Penrose drain is a drain which will look like an ICD catheter with multiple holes. It will have a gauze inside. Like you want to drain the collection, post-operative collection after pancreatitis or after pancreatectomy. If you put it inside, by capillary action of the gauze, the drained material will come out. It's called as Penrose, P-E-N-R-O-S, Penrose drain. So various drains also is one of your questions for your exam. வேறு என்ன வேணும்? அவ்வளோதான். இதை பாரு, நாங்கள் போவோம். நாங்கள் STLC போகிறோம். டெக்னாலஜி.
Thank you, sir.